Other time we talked about the natural history of cervical cancer. That means that how cervical cancer progresses from pre-cancer to cervical cancer. And we said that it generally starts as a pre-cancer before it moves over to cervical cancer. We said that from the stage of pre-cancer to the stage of cervical cancer, it takes like 10 to 20 years. That means that a woman that is coming to the health facility with cervical cancer, it did not just happen. It had been there 10 to 20 years ago. But this time we want to talk about the signs and symptoms for cervical cancer. So what are the signs and symptoms for cervical cancer? Take note, pre-cancer does not have any sign, it doesn't have any symptom. That means that a woman having this will never know that they have it. It is only through a screening that they can be able to identify a pre-cancer. But now, when it is cervical cancer, a woman might have some signs and some symptoms. And these are some of the signs and symptoms for cervical cancer. Abnormal vaginal bleeding. When I talk about abnormal vaginal bleeding, it is because there is a normal vaginal bleeding. A woman is supposed to bleed at least once in her cycle or one time in a month. When it exceeds this one time, there could be a problem. So we're saying that bleeding more than one time in your cycle needs to be investigated. It could be cervical cancer. And then also a woman that has already reached menopause. When I talk about menopause, that means the woman that has stopped menstruating for at least 1 year, and then suddenly she starts again menstruating or bleeding. That could be cervical cancer. Or a woman that is bleeding during sex. A woman is not supposed to be bleeding during sex. Or bleeding after sex. That could be cervical cancer. Or having an abnormal vaginal discharge with very offensive discharge that is not responding to any form of treatment. This could be cervical cancer. And generally, when cervical cancer is advanced, a woman could start having severe lower abdominal pains that is radiating to the legs, and if it has to spread over to the neighboring organs, for example the rectum, the bladder, she may be having difficulties of painful urination or having difficulties passing out stool. And generally when the kidneys are involved, you could see the legs being swollen. So those are the signs and symptoms of cervical cancer. And it is good to note that cervical cancer at the pre-invasive stage or even the early stage of pre-cancer does not have any sign, it doesn't have any symptom. So we are saying that women do not need to wait until they start manifesting these signs and symptoms. You need to come for your screening, because when you are being identified, when cancer is identified at the stage of pre-cancer, the treatment that is given gives nearly 100% cure rate. That is the good news about cervical cancer, that when it is identified at this stage, the cure rate is nearly 100%. And the target is every woman that is healthy, every healthy woman without yet having the signs and symptoms that we just mentioned. They need to come for their screening.